Hello everyone, Van Merkel here. I wanted to give you an update on one of my favorite patients and one of my long-term patients. She's been a patient for 12 years. She was originally came when she had stage 4 breast cancer, and she has now gone on 12 years. And she first started with us as a patient in May of 2007, and her breast cancer marker as of September 5th 2018 was 20.90, 20.9. Less than 38 is the clinical range, so she's nice and well below that. So a lot of people have good results when the numbers come down. I want to let you know that we're doing a job and she's doing the job in keeping that number low. So is she cured of cancer? No. I don't want you to think I have a cure for cancer. I don't have a cure for cancer. I don't have a treatment for cancer. Our goal is to get you healthy. We have cancer every day. Everybody has cancer every day. If I tested everybody out there for breast cancer, no one has zero, because we're all fighting cancer every day. So when she first came in, just to review a little bit, for if this is the first time you've heard this lady presented in May of 2007 with stage 4 breast cancer, basically diagnosed from a mammogram. They did a PET scan, found she had some hot spots, so it was stage 4. She came to me for a second opinion before she did anything medical, before any chemo, before any radiation, before any biopsy, before any surgery, anything. And I ran a blood test. Now the blood test is called the CA2729. That's the most common tumor marker for breast cancer in women. And as I just said, it was now down to 20.9. When she first came in to see me, that's the first thing I ran was that cancer marker, and it was at 185, which is extremely high, which correlates with her PET scan. It's truly metastasized stage 4, which they figured it was from the mammogram findings. They were so bad. And a PET scan pretty much confirmed the stage 4 breast cancer. And she came to me for a second opinion. We started on a nutritional program. We did the testing. I'm going to go over some of those test results here in a minute. We did the testing. I started her on a special diet and a special vitamin protocol to help her body get healthier. She's 48 years of age, so she had lived all those years without any cancer out of control, but now it's out of control. We had to boost her immune system up, and those numbers came down. Now, after she'd been on our program for 2 weeks, we tested her again, and that cancer marker dropped from 185 to 140 before any medical intervention. Before any medical intervention, it dropped 45 points. Wow. Within a month, it dropped from 185 to 78, and by 3 months, it was down to 35. It was below the clinical range. And we followed that all along. As you know, it's now 20. By the 6th month, she had her PET scan done, and all the hot spots in her body had disappeared. That's not the only case we've had like that, but it's pretty cool, isn't it? That all the hot spots indicating metastasis had gone away. Your body can fight cancer, and that's what we do. We get the body healthier. Now, for that 3 months of care, we did a significant amount of testing because we had to find out what was wrong with her system, what was out of balance, what's deficient, what's toxic. And when we analyzed all that, we knew exactly the direction to take, and we started getting her fixing all these things. And as I tell everybody I talk to, if you get healthy enough, doesn't matter the name of the disease. And so we just fixed everything we could. Her anemia, the low vitamin D, the liver, the low calcium, magnesium. We took care of all these things, and her body got healthier. For 3 months of care, for that cancer marker to go from sky high, extremely high, 185 down to less than 30, only cost her $3,000. That was it. That is a total out-of-pocket cost. That included all the labs. Now, this was 12 years ago. That included all the labs, all the vitamins, all the consults in our clinic at Take Two Healthcare, and $3,000. Now, let's put that into context. After she'd been on our program, on the program I put her on, her SBN special diet and vitamins, for 3 weeks, The doctors want to do a biopsy. Now, I tell my patients never do a biopsy. You either take it out or leave it alone. Most of these tumors are like a hornet's nest. They're not going to bother you if you don't bother them. But if you start poking them, you're going to fire that thing off. And most cancer markers will elevate, sometimes double or triple after a biopsy. Why would that be? So I told her not to do a biopsy, either take it out or leave it alone. And since it's a breast, I thought it'd be easy to take out. So I told her no biopsy, take it out. So she went and had it done. She had a lump removed, and they looked at 3 lymph nodes, and all 3 were positive for cancer. So is that stage 3 or 4 cancer? It's already metastasized. Now, because all those, the lump was cancerous and the lymph nodes were positive, the oncologist said that they need to do, radiation was immediately recommended for 6 weeks, followed with chemo. And they told her, if you do all the chemo radiation we want, do everything we want, you got probably 8 to 10 years to live, which oncologists thought was pretty good, because for her stage 4 cancer, that is really good. 8 to 10 years to live. Well, she's 48 years of age, trim, thin, looks awesome, takes vitamins, does organic exercise, does everything right you can possibly imagine. And now the doctor's saying, you got stage 4 cancer. You follow my advice, you got 8 to 10 years to live. In reality, what he's saying, if you follow my advice, in 8 to 10 years, you'll be dead. And what's the quality of life she's going to have? And do you think she'll even live 8 to 10 years? Probably not. I mean, we all know people who died within months, 2 or 3 years, with cancers not even as bad as hers. I know many women that didn't come see me. I hear them on the news, things like this. They get cancer at stage 1 or 2 and are dead within 3 years. So she'd like to come to me for a second opinion. Now, have I ever told her not to do chemo and radiation? No, I haven't. Here's a question I asked her the very first day I saw her. I said, Rachel, if you delay chemo and radiation 1 week, just 1 week, will that make any difference in the long-term outcome? That's all I asked, just 1 week. No, it's not. It's not going to make any difference if you got stage 4 cancer already, waiting 1 week. And so she gave me that 1 week. And in 1 week, the tumor marker, 2 weeks actually, tumor marker dropped 45 points. Pretty good, right? But does she still have cancer? So what do I tell her now? Yeah, give me another week. I've never told her not to do chemo radiation. You live and die by these numbers. In fact, it's not as important how high the number is, but the direction it's going. If the number is going down, you are winning. If it's going up, you're losing. That easy. It is that easy. Now, over the years, over the 12 years, more than 12 years, she is perfectly fine. No chemo, no radiation, as healthy as anybody you know. And she's now 60 years old. Where would she be if she had chemo radiation? She'd be dead, wouldn't she? But anyway, we've done this cancer marker, CA2729, many times over the years. Many times, maybe 100 times. Okay, now before I go into the actual numbers, how much does this cancer marker cost if you go to your medical doctor? Well, generally it's going to run anywhere from $380 to $480 for that one blood test. You can get that done in an SBN member in our office for probably around $40. $40. This is 2018. It may go up a couple dollars here or there, but 2018, it's right at $40. Now, she can order this test anytime she wants. And sometimes she'll go on a cruise and come back and say, I'm a little bit nervous, wants to know where she's at. Because maybe sometimes during Christmas or vacations, that number will creep up to 24 or 25. Now, why does it go up to 24? Why does it creep up a few points if she gets off the program? Sugar feeds cancer. She gets off the diet, the number goes up. She finds out where it is. Then she knows if she tightens up her diet, takes a few vitamins, they'll come back down. So is she cured of cancer? No. Do we have a cure for cancer? Don't have that either. But she knows that she has control over her own health. If she'll follow the proper diet, get tested, make sure she's under control, and takes the right vitamins, she can bring that number down and keep it under control. So is she going to die from breast cancer? No. Is she going to die with it? Yeah. But we all have cancer, but it's not going to kill her. Now, some interesting things about her case. Like I said, she's already doing everything right. When I look at her blood test looks pretty good. Okay, mildly anemic because she's vegan. Got low vitamin D, got low minerals, low protein, things that are pretty common. But on the blood test, nothing really showed up as to why she got cancer. No really metabolic problems. She's not diabetic, which often leads to cancer. So there was nothing in the blood that really indicated why she got cancer. And I've got the actual lab here on where her most recent cancer marker is down to 20.9. Oh, that is so exciting. But one of the things we do a hair test. You know, you can't diagnose from a hair test. You can't diagnose metabolic conditions, but you can see if they got heavy metals. Now, blue is the worst. Blue is code blue. Like in a medical setting, blue is code blue. Red is danger and yellow is warning. Anything that's clear or white is optimal. And so here on this hair test, her aluminum is extremely high. Aluminum is high and she has very high titanium. Now these down here are mineral levels, and those are a little bit out of balance, but the high aluminum is a problem. But it's in the hair, which means she's being exposed to it and it's coming out. Now, we also do our urinary toxic element challenge. It helps us to determine if there are heavy metals in your system that aren't coming out. Now, when we tested hers way back 12 years ago, this was her first test right here, where we see a high aluminum at the top, which correlates with her hair test. So when she collected just 6 hours of urine, we see high aluminum, which correlates with the hair. But really not much else shows up when we do just a urine test. Not much else shows up. But then when we use a special chelating agent, we saw extreme high levels of lead and high levels of mercury. In fact, that's one of the highest levels of lead we have ever seen. Highest levels we've ever seen. And I believe what's happening is we don't see the lead or mercury coming out on the hair test, and we don't see it coming out on the urine. What's happening is lead and mercury she's being exposed to is going into her body, but it's not going out. This lead and mercury was so high, I believe it was putting a tremendous stress on her immune system, such that the cancer got out of control. Now, if I'd have just thrown a few vitamins at her and changed her diet, but didn't take care of the extreme levels of lead and mercury, would we have gotten anywhere? I don't believe we would have. And you can see where we've tested her over the years, and the lead has come down, and the mercury's come down, and actually got her healthier, such that we're now actually seeing lead coming out the hair. Her body had impaired ability to efficiently eliminate lead and mercury. Your body needs magnesium and calcium and other minerals and vitamins, as well as special nutrients and things that we use that assist the body in eliminating these heavy metals. And again, I'm going to say it again, her body, had an impaired ability to efficiently eliminate lead and mercury. And that's what happens to a lot of people. Now, you might have cancer, you might have an autoimmune disease, you may have Parkinson's, Alzheimer's, something like that, and it is amazing in our culture today how many times people are trying to fight cancer, and they're missing the more serious, maybe the underlying base of the problem that is suppressing the immune system, overburdening the immune system. So hopefully it's given you people, if you have cancer, you're concerned about it, you have family or friends, and you're looking for answers, science-based nutrition doctors, this might be what you're looking for. My slogan is, take 2 weeks or 2 months to try a safe, natural option, because even serious problems sometimes have simple, safe, natural solutions. And that's what we did. We have got her under control, not cured. But where would her life be? Where would her family be? All of her people that she has contact with, what would have happened if she'd have been on chemo radiation and she'd be gone today? So, hopefully this helps. We'd love to help you. If you've got some health problems, have a good day. I'm Dr. Merkel.
Why do I need supplements if I eat right? You can eat 5 servings of fruits and vegetables and still not get enough vitamins and nutrients for good health. due to the quality of foods and the ways they are produced. Our food today is grown on land that has been farmed for well over 50 years. The quality and mineral density of the soil is greatly diminished due to over-farming and the chemicals, pesticides, and herbicides that are commonly used. One study found 43 different vegetables and fruits had significant declines in the amount of protein, calcium, phosphorus, iron, riboflavin, vitamin B2, and vitamin C from 1950 to 1999. The Organic Consumers Association notes similar findings with several other studies. The Cushy Institute analysis of nutrient data in the United States from 1975 to 1997 found that several nutrients dropped dramatically in the 12 fresh vegetables studied. A similar study published in the British Food Journal found that 20 vegetables had similar declining rates of nutrient value from 1930 to 1980. Yet another study concluded that one would have to eat 8 oranges today to derive the same amount of vitamin A as our grandparents would have gotten from just one. It appears obvious that vitamin supplements are necessary. In 2002, the Journal of the American Medical Association, reversing a long-standing anti-vitamin policy, started advising all adults to take at least one multivitamin each day. That was a small step in the right direction, as studies since then indicate that the higher quality foods our grandparents ate might be a major reason why that generation has less cancer, diabetes, and autoimmune disease than people born in the U.S. in the last 30 years. It is estimated that over 60 billion doses of supplements are taken every year in the United States, and the last study in 2010 did not find a single death due to vitamin supplements. The lack of proper supplementation is far greater than the risk of oversupplementation. Several studies indicate the benefit of certain supplements, such as reduced birth defects with folic acid, and reduced breast cancer and MS with vitamin D. There are literally hundreds of other studies on the benefits of other vitamin and nutrient supplements that are easily found with a simple Google search. There is no doubt that there are many other factors that can lead to higher levels of cancer, diabetes, heart disease, degenerative conditions, and autoimmune disease. But making sure that nutrient intake is optimal will always be beneficial. How do you know if you are deficient or taking the right vitamins? Without testing, you are guessing about your health. A thorough blood test and evaluation can identify deficiencies, imbalances, and diseases long before you have symptoms. Talk to us about getting tested properly and thoroughly. It is cheaper than you think, and it just might save your life and help you live longer and healthier. Start by completing our patient symptoms survey, which aids in determining what comprehensive tests to order, informs us of any medications you are taking, and indicates the symptoms you are experiencing. Once your test results are in, we compile all of the data in a comprehensive, color-coded report that is easy to read and understand. Using your unique test data, the Science-Based Nutrition Report will reveal your underlying health deficiencies and indicate the nutrients and diet that will likely help you progress toward a healthier you. Contact us today to learn more about the Science-Based Nutrition Program.